I'm Dr. Afsana Safa. I'm a GP here at the Marylebone Health Centre in Central London. I'm also a governing body member for Central London CCG, and I am the clinical cancer lead for North West London STP. As a clinician, we're really well versed with advocating for the patient. Our lives are about the patient interactions, and we're quite happy and safe in our clinician bubble. But what we don't get taught and what we don't realise is how the whole wider system of the NHS works. How do we actually affect change to make systems better, to make services better for patients? What's the language that we need to learn? How do we really understand the details of change management? And it's those skills that we don't get at medical school or in our training that is something that the Nye Bevan programme gives and is so valuable for clinicians like me. One of the things that really surprised me was, in order to understand ourselves better as leaders, we were taken on our journey through our own past. I think one of the most powerful things about going through an experience like that is a deeper understanding of yourself. For me, what I realised is that I'm very values driven, and a lot of the decisions that I've made regarding my career or other life events have been based on my values. And that was really important for me to understand, because it really makes me realise why I do a lot of the things I do, or say some of the things I say. One of the really valuable parts of the programme is getting to know the other participants of the Nye Bevan programme. You get to meet senior leaders from all over the organisation, and this is really, really important because you get to understand their perspectives, their culture and their roles and responsibilities in a way that you never understood before. So now when I bring this back to my job here in Westminster and I meet my senior leaders in the trusts, I understand their point of view, I understand where they're coming from, and that makes me much more effective as a leader in communicating, pushing forward the agenda that suits all of us in a much better way for the patient and for the system. One of the real benefits of the Nye Bevan programme is that it really helped me to look at the way that our board functions and the way that I work within the board. So previously I saw myself as a clinician, as a single member, attending the board and giving my opinion. But actually with the teaching around this programme, I now see it in a completely different way. So I see the board more as an organism working towards one goal, with the patient in mind, with the services in mind and the staff. And actually how do we work and progress forward together with all the individual components bringing different parts, and that has changed the way that I interact with the board and my responsibilities towards the board, and I think it's made me a far more effective board member. I would recommend the Nye Bevan programme if it meets your objectives. I think for me personally, I've taken a lot away in terms of really understanding myself, understanding the NHS as a whole, which has actually given me some energy back in thinking about how I can affect positive change.